I wanted to show you a quick and easy way to do a hip mobilization to help your patients improve hip mobility, lengthen or stretch out the posterior capsule of the hip joint, and to inhibit some of the deep muscles like the psoas major or the piriformis. So just start by having the person lie supine, and you're going to bend the hip so that they are in what we call half hook lying. You're going to take your mobilization belt and put it around your waist, as well as putting it around their thigh. Now you never want the belt in direct contact with their leg, so once it's around your waist, you're going to take your hand and place it to the inside of the belt, so your hand is in between the belt and their thigh. Take your other hand, forearm, and stabilize the knee here, and then I'm just doing a little backward lean to do a mobilization of this hip. This is a lateral mobilization, grade 3 mobilization of the hip joint. Now this oscillation should be about 1 a second. 1, 1,000, 2, 1,000, just like that. Perform 6 to 10 repetitions. This will begin to warm up the joint capsule, and it can also serve to inhibit if there are trigger points in some of the deep intrinsic muscles of the hip, like the piriformis and the other deep 6 and the psoas major. After you do a lateral distraction, you want to do a little posterior glide. I just take my knee and I put it underneath their knee and let their leg rest on my leg. Now the reason I do this is so I can pull my leg distally here to put a little bit of distraction on the hip joint. Then I can lock my elbow straight and do a posterior glide. Again, a grade 3, which means it's a larger amplitude mobilization in the end of the range. 6 to 10 repetitions. And that's a quick hip mobilization technique you can use to help your patients improve hip rotation.